Okay, so I wanted to cover the skull here. And the skull is, what sits on top of your spinal column. We have cranial bones, and the cranial bones are just the bones that enclose your cranial cavity. And of course, this is for protection of your actual brain. It's also attachment sites for some head and neck muscles, and we'll go through those in the muscle chapter. In addition to cranial bones, the skull contains facial bones, and these are obviously on the anterior part of your skull. These form the framework for your face and the cavities for your eyes and your nose and your mouth. They hold your teeth, and of course they anchor the muscles of your face, and they give you the shape of your face. Okay. So, sorry. The cranium is the vault, means vault. Well, that's weird. Or it's also called the calvaria. This is the skull cap. If we take the skull cap off, which they do in autopsies, then that's the calvaria, just the superior portion of the skull. So if we remove that and we look down into and we remove the brain and the meninges and all the soft tissues, what we see are three areas here. I know there are 1, 2, 3, 4 colors, but if you look at a skeleton, a skull, you see there's a depression here. It's for the frontal lobe of the brain. It's called the anterior cranial fossa. And then there's a second level, which is deeper than this one, called the middle cranial fossa. And then the deepest one is the posterior cranial fossa. Okay, so this is the floor of the cranium, right? This is the frontal bone here. This is the sphenoid bone here. These are the temporal bones. This is the occipital bone. We'll go through that in a moment. So again, anterior, middle, and posterior cranial fossa. The cranial bones, remember these are the ones that enclose your brain, is the frontal bone, 2 parietal bones, those are like sort of superior to your ears, 1 occipital bone, that's the back of your head, 2 temporal bones, those are around your ears, a sphenoid bone and an ethmoid bone. You'll see where those are. So here are the temporal bones. See, they surround your ear, and all those inner ear structures, like with those 3, those 3 middle ear bones, inner ear bones. Those lie within what's called the petrous part of the temporal bone. So this is a thick bone because it has a compartment in it that contains all of your hearing mechanisms. This is the parietal bone. There's a pair, 1 on each side. The frontal bone is on the front, and the occipital bone is on the back. Pretty simple. The sphenoid bone is on the front part, and it sort of participates in the facial bones as well. But frontal, occipital, temporal, parietal. Then you've got pretty much that part down. So we're going to start with the temporal bone. If we take the temporal bone out, we tease this fibrous joint apart. You see how irregular it is? The fibrous tissue holds this to the parietal bones on top. What we have, and I've marked these in yellow. These are the ones that I want you to know. I don't know why that's doing that. So I need you to know the external acoustic meatus. This is your ear canal. So the lobe of your ear is out here, and this is the hole. This is where you put the Q-tip in. Then there's a mastoid process. This is kind of a lumpy, dull, circular projection right here. You can feel it behind your ear. And this is the styloid process. This is more medial than the mastoid process. This is very delicate, and it's for muscle attachments. And it looks like a styloid. Styloid means needle. Okay? So this you cannot feel with your fingers. This you can feel. And the last thing is the zygomatic process of the temporal bone. There's also a zygomatic process of the zygomatic bone. So this is the zygomatic process of the zygomatic bone. Now if you'll notice, no, that's not going to work. Right here, it's a pretty long process. So that's a temporal bone. You need to know 1, 2, 3, 4, just 4 parts of it. That's all. Sorry. So the sphenoid bone, so weird. The sphenoid bone. Sphenoid is sort of I think it means wing, but it's more bat-shaped. This is how it looks on the floor of the skull over here. Looks sort of like a bat. Here are the eyes, here are like the horns, and here are like the wings. Okay, so this is the optic canal, and the optic canal is obviously where the optic nerves come from the eyeballs. Okay. The sella turcica means Turkish saddle, and it's right here. Okay, here. I guess that's supposed to be a drawing of that. And then we have these different foramen, and foramen means hole or passageway. These are for blood vessels and nerves to pass from inside the brain or inside the calvarium, the skull, the cranial cavity, to the outside. Because obviously you need a blood supply to the brain, so we need holes in that skull cavity to bring in blood, and then we need holes also to take nerves out from the brain. That makes sense? Yeah. Okay. So optic canal right here, sella turcica right here, and then right here is called foramen ovale. That's ovale is oval for the shape, and just inferior and lateral to that is the foramen spinosum. Up here, and this is kind of in a little bit of a lip, it's called the foramen rotundum. So it's R-O-S, R-O-S. Any way that you can remember them is good. You're only going to have to remember them for the exam. You'll never have to really know these, but we have to teach you what they are. And up here is the superior orbital fissure, but there's a better picture of that. Here's the superior orbital fissure here. This is the inferior orbital fissure down here. So know these in yellow. And then the ethmoid bone is like the top part of your nose, kind of deep to the surface. This is called the crista galli, and when you see your skull, when you have your skull in your hand, you can see that much better. These are the olfactory foramen. As a matter of fact, right here, this is the crista galli here. These are the olfactory foramina. What happens is that the first cranial nerve, which is the olfactory nerve, which is the nerve for smelling, they lie right here. It's a pair of them, okay? And they lie right here, and then they send projections through these holes into the roof of your nose. And chemicals come into contact with those receptors, and that causes smell. That's a much better picture of it than the one than this one that we're looking at here. Okay, so the cribriform plate is that plate that has those holes in it, and there's a little projection superiorwards, and that's the crista galli. Okay, and the little holes are olfactory, foramen or foramina for plural. The perpendicular plate is this long plate that comes down here, and then the middle nasal concha is right here. That makes more sense when you can see it right here. Here's the superior nasal concha, here's the middle nasal concha right up here. The sutures are these interlocking joints. They're fibrous tissue joints, and they, when you're a small child and you're born, your skull is smaller than when you're an adult. So the body leaves has to find a way to grow, right? So those bones are going to grow larger so that your head will become an adult size. And when it's fully ossified and it's its adult size, then these joints will, the fibers will become very strong. and for the most part immovable. Those are called sutures. They're irregular, kind of sawtooth in shape, and the largest four that you'll be responsible for are the coronal. So that would be on the coronal plane from ear to ear over the top of your head. The sagittal, front to back, that separates the two parietal bones. The squamous and the lambdoid, I'll show you. So here's the coronal. Here is the squamous. Squamous means flat. Okay. And here's the lambdoidal, between the two parietals and the occipital. See, there's another one here, occipitomastoid. It pretty much is self-explanatory. Now, this looks like a lot of stuff here, but it's really not. You know the parietal bone, the frontal bone, the sphenoid bone, the temporal bone, the occipital bone, so you can forget about those. You know the names of the sutures, so you can forget about those. You know the names of the external auditory meatus, the mastoid process, the styloid process, so you can get rid of those. And that's how you do it. You look at this, you'll remember 5 or 6 things, and then the next day you look at it again. You go over those 5 or 6 things, and then you learn 2 or 3 more. And you do the same thing the next day, and the next day, and the next day. And pretty soon, I promise you, if you look at this every single day, it'll become more and more familiar, and you go, oh, I know all that. Okay, so here's your zygomatic process, because this entire thing is called the zygomatic arch, right? But this is the zygomatic process of the temporal bone, and right here is the zygomatic process of the zygomatic bone. So I like to ask that because it's a little bit confusing, just because I can. There's a suture here between these two bones, and you can find that on the real skulls, the human skulls. It's kind of fun to look at. And, if someone gives you a slug right there in the face, that'll just crack. Then we have the ethmoid bone, which is right here. The lacrimal bone. Lacrimal means tear. Lacrimal bone's right in the middle, the middle part of your eye. I don't mean the center part of your eye, I mean by your nose, right here. It holds the lacrimal duct. That's for your tears. This bone here is the maxilla. This one here is your nasal bone, and you'll notice that nobody's nose looks like that. Your nose looks like that, right? But that's all cartilage. These are the alveolar margins, and alveolar margins are for your teeth. This, of course, is your mandible. I've gone over the mandible in another video, so I won't do that now. Just as a posterior view, you know all of this. This line right here is the superior nuchal line. This is for muscle attachments, so hold your head upright. It's a postural muscles. This is the inferior nuchal line. You don't need to know that, but you do need to know the occipital condyles. These are the two surfaces which articulate with the vertebrae. Here again is your mastoid process and the lambdoid suture. I think everything else you know on that. The cranial cavity houses the brain. The smaller cavities are like the middle ear cavity, the inner ear cavity, the nasal cavity, the orbits, that's the eye cavities, and sinuses, those are just holes in bones. The openings and canals and fissures for blood vessels and cranial nerves. The skull has cranial bones, we just went over those, and facial bones. Okay? So the facial bones are the mandible, the vomer, the maxilla, and it looks like one bone, but it's, left and right halves. Zygomatic bones, those are paired. The nasal bones, the lacrimals, the palatines, and the inferior nasal concha. It doesn't really matter that you know that they're paired. That's trivia, and only if you're a facial-maxillary surgeon would you need to know that. If you learn the names of the bones, if you can point them out, I'd be very, very happy with that. So again, this is the frontal bone. Here are the parietal bones. You don't see much of them on an anterior view like this. Again, I put the facial bones over here on a list so you can see them quite easily. Here's the nasal bone. It's just the upper part of your nose. So when you break your nose, you have to ask, did I break the nasal bone or did I break the cartilages? Okay? And usually when you have like a nose job, if there's a bump on this, that's pretty easy to fix. The cartilages are a little bit more difficult to fix. They have to take it out and recarve it or get a preformed nose, something like that. And you understand what I'm saying. Okay, the sphenoid bone, the sphenoid bone is just this part. And they put it the same color as this so you can't tell. But it shows up on the side, and I will ask you for that. The sphenoid bone is sort of the back part of the eyeball. This is your superior orbital fissure and the inferior orbital fissure. Okay? And these two little dots are the optic canals. So the optic nerve from your eyeball, that's the, that comes off of the retina, is going to go posteriorwards over the sella turcica and back to the occipital lobe. These are for muscle attachments and other blood vessels. Here's the ethmoid bone, here's the lacrimal bone, maxilla, zygomatic, and of course your mandible down here. Anything I missed? Infra means under. Infraorbital, this is the orbit. Infraorbital foramen, hole. These are the mental foramen. Here's the vomer bone, the very bottom of your nose. This is the middle nasal concha, the perpendicular plate we saw on that ethmoid bone, right here. Here's the inferior nasal concha. Okay. And what else? I think that's it. Again, I promise you, you look at this every single day and it will become more and more familiar. So on this picture you need to know everything. Actually we've been over every single thing on this slide, but it's a good thing to look at this, maybe print it out and cover up the names and test yourself. That's the best advice I can give you. Okay, next, moving on. If we make a mid-sagittal cut and look at the inside this way, we can see these sphenoid sinuses. You don't need to know them, but when you get a brain freeze, you eat ice cream, the cold transfers up into these sinuses and squeezes them. So that's where that pain comes from. So this is just an interesting view. You don't need to know the ones that are in red, but you do need to know everything else. Here's that frontal sinus right here. You get headaches there. Now let's look at the inferior view. So we're coming up from underneath. There's a big hole at the bottom of your skull called the foramen magnum. Magnum means biggest. Magnum. So your spinal cord will come up and pass through this foramen, and as it passes through, it changes its name from spinal cord to brainstem. Okay, now it's part of the brain. Now they have to call it something else. If you put your finger at the back of your skull, you'll feel a knot, a little knot size of a pea. It's called the external occipital protuberance, and it's for muscle attachment. So you know the names of the bones, the styloid and the mastoid. Here's a good view. You see the mastoid here laterally, and the styloid is quite medial to it, and it's underneath. You can't really feel it with your finger. Here's the jugular foramen. This is for the jugular veins. Here's the carotid canal for the carotid arteries. This is the stylomastoid foramen. It's easy to find because it's between the styloid right here and the mastoid foramen. So that one's easy to find. The foramen ovale we already talked about right here. And so up here, the hard palate, you can feel it with your finger. This is the maxilla here. And this is the palatine bone. This is actually called the maxillary process of the palatine bone. But anyway, this is the maxilla. This is the palatine bone. It's small, okay? And posterior to that is this vomer. And here, again, anterior middle and posterior cranial fossa, foramen magnum. Here's your jugular here. They look different from different views, so you just have to look at that skull a lot to figure out where these are. This is the hypoglossal canal right here. Here is a foramen lacerum. That means cutting. It has kind of a sharp edge here. Foramen spinosum. Remember this ROS, rotundum ovale spinosum. Cribriform plate right here. This is all the cribriform plate. This ridge right here is the crista galli, and these are the olfactory foramina. Just another view of a real skull. Another view of a real skull. You have access to this PowerPoint, so it's not a problem. You can just download it. So the here's the maxilla here. This is your upper jaw. We have an infraorbital foramen, the zygomatic process of the maxillary bone. Right. That's about it. This is the mandible, the body of the mandibular angle, the ramus of the mandible, mandibular condyle, mandibular notch, and this is the TMJ, mandibular condyle, and the mandibular fossa of the temporal bone. I could ask you on the TMJ which two bones are involved, and you would say the temporal bone and the mandible, right? So this is the coronoid process. That's all you have to know there. This is the nasal cavity. It's very complex, but I don't care that you know very complex. This is a good mid-sagittal section. Here again, frontal bone, nasal bone, maxillary bone, ethmoid bone, which is the superior nasal concha of the ethmoid bone. I think it's the middle nasal concha. This is the perpendicular plate, inferior nasal concha, and vomer. Okay. Again, superior nasal concha is up here. Can't really see it from the front. The middle nasal concha you can see. And the inferior nasal concha is a separate bone. Okay. The ethmoid bone contains the superior middle nasal concha, but the inferior nasal concha is its separate bone. Now, the reason for the concha are to spin the air that comes in your nose. You want to spin the air to expose it to the mucous membranes in your nose, to get the dust particles out, to get the pathogens out, to make them stick to that mucus, and also to air condition the air, to either cool it down or warm it up. And also, one more thing is to humidify it, okay? Because your lungs are very sensitive to like dryness, so you want to make sure that it's humidified. Now the orbit, here's your superior orbital fissure, inferior orbital fissure. Here's an infraorbital groove right here. This is the inferior orbital fissure. Wait. This is the infraorbital fissure right here. This is the inferior orbital fissure. This whole thing right here. Yeah, we said that first. Here's the medial wall of the eye socket. Here's part of the ethmoid bone right here, the lacrimal bone, the maxillary bone, and the nasal bone. Again, look at these daily. You don't need to know this. I put this here so you'll understand sinus headaches. Okay, moving on down to the hyoid bone, greater horn, lesser horn, body. That's all you have to know. And the rest are on the other videos that I made. Hope that helps.